Welcome to The Explainer. Today, we're tackling a massive question in medicine. How do we treat chronic pain? And maybe more importantly, are the drugs we're all using actually doing what we think they are? Just imagine for a second a pain that isn't from some obvious injury, like a cut or a burn. Imagine a pain that's coming from your nervous system itself, a pain that just lingers for months or even years. Well, for a staggering 7 to 10% of adults, this isn't some hypothetical. It is their daily reality. It's a condition called neuropathic pain. The best way to think about it is like a faulty fire alarm in your body that just keeps blaring, even though there's absolutely no fire. The pain is caused by damage to the very system that's supposed to tell us about touch and temperature and pain in the first place. Okay, so here's the game plan for this explainer. First, we're going to really understand this faulty alarm. Then we'll try to navigate the pretty confusing maze of treatments. After that, we'll dig into the really surprising evidence behind one of the most common treatments out there, antidepressants. We'll even explore a wild new theory on how they might actually be working. And then we'll wrap it all up with what this means for the future of pain. So let's get into it. What is actually going on inside the body when this pain alarm goes completely haywire? The International Association for the Study of Pain gives us this really precise definition. And the key words you've got to focus on here are lesion or disease. This isn't just some vague feeling. We're talking about real physical damage to your nerves, your spinal cord, or even your brain. Figuring this out is a super meticulous process. This chart here shows how it works. It's kind of like a funnel. Doctors start at the top, just listening to a patient's story, listening for key words like burning or shooting pain. Then they move down to physical exams and can end up with really specific tests to find the exact source of that faulty alarm. All right, so once you have a diagnosis, what's next? How do you treat it? Well, finding relief can honestly feel like you're navigating a maze with a whole lot of different paths and potential dead ends. There are guidelines out there, like these ones from France, that map out a step-by-step approach. Doctors don't just throw everything at you at once. They usually start with what are called first-line drugs. If those don't work, they move to the second line, maybe combining a few things. And it's only after all that has failed that they even consider the really heavy-duty stuff, the third-line therapies, like, say, strong opioids. And right there, in that very first line of defense, we find something interesting. Antidepressants. Yeah. For years, they've been a go-to treatment for neuropathic pain, prescribed not to lift your mood, but because they're thought to have a direct effect on pain signals. So this brings us to the absolute heart of the matter. We know doctors prescribe antidepressants for pain all the time, but what does the hard evidence, what does the science actually say? Do they really work? I mean, with so many different kinds of antidepressants on the market, you'd think the science is pretty solid across the board, right? But is that actually true? To find out, researchers at the Cochrane Network did something huge. They didn't just look at a handful of studies, no. They analyzed data from a whopping 176 different trials, which involve almost 30,000 patients. This is one of the biggest, most comprehensive looks at this data ever. And what they found? Well, it's kind of a bombshell. After sifting through all of that mountain of evidence on 25 different drugs, they found reliable, high-quality evidence for only one of them in treating chronic pain, a drug called duloxetine. This visual just lays it out so clearly, doesn't it? On one side, you have duloxetine, backed up by solid science. And on the other side, well, you have a whole class of other widely used medications where the evidence for pain relief specifically is either pretty weak or just not there. So this begs a massive question, right? If duloxetine works, what on earth makes it so special? And the answer, well, it might force us to rethink not just antidepressants, but maybe the very nature of chronic pain itself. Okay, so here's how it seems to work. When a nerve gets damaged, your body's immune system kicks into gear. It sends out inflammatory cells, and those cells release these little chemical messengers to sound the alarm. One of the most important messengers here is something called TNF-alpha, and it helps drive a process called neuroinflammation, which is literally inflammation of the nervous system. And it's this constant state of inflammation that's thought to keep those faulty pain alarms ringing and ringing. And this is where things get really, really cool. The new theory is that these drugs might not be working on brain chemistry in the way we've always assumed. Instead, as this diagram shows, they may actually be cooling down that neuroinflammation. They seem to act right on the immune cells, telling them, hey, produce less of that inflammatory messenger, TNF-alpha. So the pain relief might not be coming from a change in mood at all, but from calming that inflammatory storm right where the nerve damage is. So, after that deep dive into the science, what's the bottom line? What are the most important things you should really take away from all this? First off, neuropathic pain isn't just in your head, it's a real condition caused by nerve damage. Second, treating it is complicated. It's a careful, step-by-step process. Third, and this is the big one, the evidence for most antidepressants as pain relievers is way weaker than we thought, with that one major exception, duloxetine. And finally, the reason that one drug might work could be a total game changer, pointing to inflammation, not just brain chemistry. Which leaves us with a really provocative final thought. For decades, we've thought about chronic pain as a problem with our nerves. But what if the key to finally turning off that faulty alarm isn't just in the nerves, but in the incredibly complex dance between our nervous system and our immune system? It's a question that could change millions and millions of lives.